It's Patrik Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. Now, one of the comments that we're getting all the time is that ICUs are very cruel and they're very unethical and they have no morals. And first off, I worked in intensive care for over 20 years in 3 different countries, and I have worked for over 5 years as a nurse unit manager in intensive care. And I have been consulting and advocating for families in intensive care for the last 9 years, coming close to 10 years. So I'm talking to families in intensive care all over the world every day. Now, whilst I can totally resonate with what our readers and clients are saying, that ICUs are cruel, unethical, and they have no morals, I can agree with that, but I also need to really point out that there are a lot of good things happening in ICU and we never hear about it. People leave ICU alive and they move on to the next phase of their lives, and they go back home and go back to their lives, okay? But we don't hear about it, and but that is definitely what's happening. I guess what I've noticed sort of in the last few years in ICU, and the more I understood about the politics and the business cases and where the money is flowing and all of that, then I realized, okay, there are many unethical things happening in ICU just simply because of money, just simply because of some doctors' opinions about quality of life, and some doctors clearly dismissing what families in intensive care want and what's important for them. So that was one of the main drivers for me to not only start intensive care hotline, but then also start intensive care at home, because there are alternatives. There's a much better way to look after some ICU patients, give them quality of life at home, give them quality of end of life at home, get them out of ICU and so forth. So why are ICUs cutthroat, cruel, unethical, have no morals? Again, it comes down to limited resources, comes down to limited finances, or what I should even say, perceived limited resources, because I also believe a lot of it comes simply down to advocacy and advocating for what is right for people. So what are the strategies to counteract the cruelty of some ICUs? Well, the strategies are really to get help, to have a professional advocate on your side that can ask the right questions, because the biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for, they don't know what questions to ask, they don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And if you are armed with that knowledge, your life will be so much easier, because all of a sudden the intensive care team understands that you have help on your side, and they understand that you are a force to be reckoned with. And that is really important. Most families in intensive care get walked all over because, again, they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights. They don't know how to manage doctors and nurses in intensive care. So yes, whilst you are right when you say that some ICUs can be very cruel, unethical, amoral, and but that's something you can't control. What you can control is starting to ask the right questions, get professional help. That's the thing that you can control, and you should start controlling that from now on, so you don't have to worry too much about what ICUs are doing. Focus more on what you can do. So that is my quick tip for today. If you have a loved one in intensive care, go to intensivecarehotline.com. Contact us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com. Also, have a look at our membership for families in intensive care at intensivecaresupport.org. If you need a medical record review for your loved one in intensive care or after intensive care, or for yourself, contact us as well. Now, subscribe to my YouTube channel for regular updates for families in intensive care. Give this video a like. Click the notification bell, comment below what you want to see next or what insights you have from this video, and share the video with your friends and families. Thanks for watching. This is Patrik Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.